And as you can imagine, when you do a project like Partners for a Malaria-Free Zambia or Rotary Healthy Communities Challenge, you rely on data to make all decisions. And Todd will talk about data collection, data analysis, and how it's used to make decisions going forward. Thank you. Todd?
Thank you. Good morning. Again, Todd Jennings with PATH, based in Zambia. Jenny, for the record, she said 18 years. It's only been 17. Just wanted to clarify that up front. Yeah, and it's just wonderful to be a part of this. A lot of familiar faces. And so thank you for the invitation to speak. I want to talk about data, but also want to keep you awake. People tend to nod off when they hear that. Because Zambia has a good story to tell about how they use data to focus and tailor limited resources in controlling and eliminating malaria. But first, just a couple notes on this photo. I like it for two reasons. One, it's a good reminder of, for those of us, especially that sit in air-conditioned offices in urban areas, of our primary audience in fighting this preventable and treated disease. And two, my wife took this photo. So if I don't give her proper, photo credit, I get in a lot of trouble. So when she was reviewing this, that was, I needed to be sure that was mentioned. All right, so if someone asks you, what is the malaria situation in Zambia? That's a broad question. How would you answer that? 14%. That's one way to answer that, and it is true to a point. There's surveys that are done every 2 to 3 years, the malaria indicator surveys, which is a national snapshot of the situation. Those started in 2006. Zambia was one of the very first countries, and this is the most recent one from 2004. And so you can see in this, just the range, again, when we're talking about what is the malaria situation, this would have been children under the age of 5 that were tested at the time of the survey. So in 2024, it was 2,526 children had their fingers pricked for the test. So you can say 14%, but that's not a really accurate representation. Zambia is, depending on the audience, I like to say Zambia is bigger than Texas, bigger than France. And so it just gives you a size of the immense scale of it, but there's only 22 million people. So again, the population skews rural. And so that's really important in a disease like malaria. As Martha was explaining, it's important to bring the health services to the people instead of expecting them to come to health facilities. So here you can say 14%, but wait a minute, up in, say, Luapula, it's about 28%, or northwestern, that's bordering DR Congo. And then southern Zambia has less than 1% for that province. And again, in the malaria circles, there's a sort of Zambia fatigue. There's been a lot of investment in Zambia, a lot with the Gates Foundation. And so in the survey in 2018, that was actually 0.0% for Southern Province. That doesn't mean there's no malaria there, but during the time of the survey, it meant that no one tested positive for the disease. So it's just important to keep that in mind for looking at data that, yes, this is gives some good information, but to really understand the situation, we need to go much deeper. So how do you get information from a malaria test to, let's say, a Ministry of Health person in an office in Lusaka? So it often begins with a child presenting fever, headache, joint pains, chills. And so a community health worker conducts a malaria test. So here's a malaria test. If you see 2 lines, that's a positive test. And so then, with this case, then the patient was given the treatment, and then the community health worker that is conducting the test, he or she has a register, handwritten register where you log the information, whether the case was positive, whether it was negative, the treatment given. And then that information, that's the example of that, and that then information is gathered together every month at the health facility. All the community health workers go and meet with their supervisor, and then they look at the data, aggregate it, and that's submitted via mobile phone. I need to update this photo. All the phones now are very smart. This is a feature phone, and so yeah, it's quite amazing with the cost reduction per unit that there's a lot more smartphones. And then it's at district level, the information, and then finally it is sent onto the national level, and you get a dashboard where, again, the whole point of that is this is a lot of information. There's weekly information from health facilities, and there's monthly information from the community. So how do you make sense of all this information? I know, this is a lot. But again, we're standing between you and the coffee break, so I think together we can get through this. So this, again, is how do you track a lot of information over time. There's been mentioned a lot of the Partners for Malaria-Free Zambia. So we're at a Rotary meeting. So up top there, you can see all 10 districts that Martha was talking about. There's over 2 provinces that were a part of that project. And then the graph below, you can see over time what that looks like. So on the top part, if this was a live dashboard, you could take the first one, let's say Luano District, you click on that, and then up comes all the health facilities that are in that district. And then you can even click on a health district and see all the community health workers that are attached to that district. So again, a lot of rich information, and from that you can see what the situation is as far as number of cases. The blue ones there are the clinical malaria cases. That just means usually an absence of commodities, where they have to base it on the symptoms because there might be a stock out of the tests and treatment, so they can't know for sure whether someone has malaria. And there's a number of diseases that present the same symptoms, so it's really important. And then below is the information over time. The light band is the number of cases that are managed at community level by the community health worker. And then you can see the seasonality with the spikes. In Zambia, it's from November to April are the rains. And so you can see an increase in malaria when there's an increase in the number of mosquitoes. And so you see that transmission effect over time. But it's important with all of this data, you could look at, say, 2021, that, right there, and it's just like, it's really low. And you're like, wow, there's no malaria. But you have to understand the context in that that was before the community health workers were introduced. The malaria was there, it was infecting people, but it wasn't being detected. So that's another thing too, when people come on board and they want to invest in community health workers, cases go up. And they're like, whoa, what's going on here? But you see that, a chart regularly, cases will go up and then slowly decrease over time. The squiggly line, the gray line on top, that tracks that management of community health workers managing disease as a portion of total cases. And so that's a key takeaway. This project ended in 2024. This is from, I think, April of this year. So the reporting is continuing, and 60% of malaria cases are managed at community level. That is critical because, as we heard from Martha, the clock is ticking. When there's a positive case. Time is of the essence, and so it's really key to catch infections early. In addition, you're taking the burden off health facilities when they have less patients to see. So again, a lot of information, but it's really important as well, when you look at key pieces, you have to understand the context. It's like with the stock market. If you base your decision making on one day of trading, or a week, or even a year, that doesn't necessarily, provide you the information you need over time with trends to really make a decision and understand what's going on. And that's taking the same thing and looking annually at the percentage of cases detected by community health workers. So this is going from those 10 districts, and now we're looking nationally. So 2016, just 1%. And then you see over time with the expansion of the community health worker network, it's over 1/3. Early this year, you can see that's up to 37%. So that's just huge as far as this understanding the goal of treating cases at community level. Now let's talk about mortality. And so you can see these trends over time. Before it was close to 4,000 cases in 2014, and now we're down to, in 2024, it was 1,200. So again, the trend line is positive. You see 2020, that's likely because of the pandemic, and because, again, the issues with commodities and the irregular flow of those, had an impact. And so you see it going down, but even 1,200 cases, that's 3 Zambians dying per day. And as we all agree, that's 3 too many for a disease that's preventable and treated. And then you have 2025, and you're like, well, that doesn't really show much. This is just the first quarter. But then when you look at the first quarter in more detail compared to quarter 1 of 2024, yes, it is encouraging. Those are total malaria deaths. The ones in light green, those are children under 5. And then the blue is everyone else, so above the age of 5. And so again, it's an encouraging trend, but we need to keep pushing to see those trends continue. Whoops, there's rain. Oh, the other map isn't there. Anyway, there's a map of community health workers, and I mentioned the growing community network, and I think there will be a slide on that a little bit later. But it's important to understand there's 25,000 community health workers. That's like this army spread across the country. And that is just huge. The national target is 40,000. So that's why we've heard that investing in community health workers providing this treatment and testing and tracking, this is what this is all about, and it's important to have the 3 T's as part of that, because then with that information, you can make decisions oftentimes with limited resources. That situation is even more so pressing, so we need to be good stewards, better stewards with even more, in a resource-limited environment. And so again, we saw the map, like we get a bunch of bed nets. Well, it's really convenient to distribute them in Lusaka, in the capital city. You'd be like, that's great. That's not where the problem is. And so you need to plan to get those nets where they really need to go. And that's not easy, but it is important. So thank you.